For the longest of time, Africa seemed immune to the coronavirus, but now reality is hitting home. The continent is edging ever closer to the 6,000 COVID-19 confirmed positive cases. With 196 deaths, countries are locking up. But what should we be doing different? Good evening and welcome to African Perspective. I'm Aldrin Simpier. Tonight, we look at countries going into lockdown and we ask the head of Africa's Center for Communicable Diseases and Prevention, what are the major threats the continent is facing? We also love to hear from you. You can tweet us using the hashtag African Perspective. A private hospital in Addis Ababa is offering to train medical professionals from other hospitals to operate a medical ventilator. Many hospitals in the city don't have intensive care services and therefore lack ventilator specialists with COVID-19 causing respiratory failure in some cases. Knowledge around ventilators is considered crucial. SABC's Coletta Wanjoyi reports from Addis Ababa.
Respiratory therapist Haptamo Kahali has been training colleagues from Addis Ababa hospitals how to use ventilators.
Before, maybe it's only doctors who are using or working in the intensive care unit that they were familiar with these machines. But now we may need everyone, like has professionals working in hospital, to utilize the machine that they get. They may want or they may need to go to a setup where they have never been before and need to operate those machines. So because the fact that these machines have got the basic principles, they don't have to be shy. They just have to read the manuals and start using those machines.
According to the World Health Organization, 1 in 6 people who contract coronavirus can become seriously ill. To those patients who do become seriously ill, ventilators can be vital. This hospital plans to train at least 100 medical practitioners for free, with the hope that they will also go and pass on the information to others. These doctors are also discussing complications that may arise in COVID-19 patients based on experience from other countries.
At the end of this training, we're going to have a platform, like a social media group. So we're going to ask each of the trainees to go back to their hospital and see what machines, what modern machines that they have. And if they have any issues, we'll try to go in person or on site and assist them to start operating those machines.
In Ethiopia, only government-owned hospitals are allowed to attend to COVID-19 patients. But some private hospitals like this one, which has at least 6 intensive care beds, say they will assist if permitted.
We are also teaching our patients how to prevent themselves, and we are teaching them also how serious this illness is and how they prevent themselves and their families. So we are partly teaching and we are ready for any complication. If the government allows the private sector to be involved in any instance, as a private sector, we are ready.
Ethiopia currently has 435 ventilators. That is far from its target of at least 1,500. Importers of medical supplies in the country say there is a shortage of ventilators globally. The cost of some ventilators has also jumped as much as 6-fold due to the high demand. As government grapples with supply, some citizens like Addis Alemayo are trying to help attract donations of these vital machines through social media.
Well, it came about from sitting around with a couple of friends. This was before the shutdown, and talking about what needs to happen, and realizing that the news that came out that China had shut down its 3 major hospitals that is built in a week. And so I personally started a campaign with a couple of friends of mine to actually highlight the fact that if those hospitals are closed, maybe Ethiopia deserves one of those hospitals here in the country. Since we've never stopped flying to China, we've always supported China throughout the campaign.
It is an optimistic call, but Addis hopes it is one that can help Ethiopia tackle the virus and ensure businesses also survive the outbreak. Coletta Wanjoyi, SABC News, Addis Ababa, Ethiopia.
There are warnings that Africa could be worse hit by the coronavirus, while the prevalence of the virus in countries such as Italy has been detected in elderly patients. Africa faces a unique challenge. Although the continent boasts a young population, Diseases such as malaria, HIV/AIDS and TB put them at high risk. Right now, we're joined by John Nkekasong, who is the Director of Africa Center for Disease and Control and Prevention, who joins us on the line. Good evening and welcome to African Perspective. Doctor, let's first start off from the conversation that we just heard now, the package that just played, speaking about ventilators and the cost of ventilators increasing during this particular period. What does the CDC have to say about this? Hi, Dr. John, can you hear me? Dr. John, can you hear me? Okay, we'll come back to Dr. John to have that conversation around what Africa's response should be to the coronavirus and why it should be a unique response. Why is it that although we look to Italy as well as China and the preventative measures that they have put in place, why we shouldn't use that as a mere blueprint and try to apply it here on the continent, especially in sub-Saharan Africa? As I've just indicated, you look at the HIV/AIDS rate, you look at the TB rate, tuberculosis rate, as well as the malaria rate that the continent is currently facing. How do you make sure that the countries on the continent are ready to respond to that? At the moment, as it stands, we have 49 African countries that have confirmed cases of COVID-19, and also the death toll also increasing at the moment. We'll try to get back to Dr. John in the next while. In the meantime, East African Regional Bloc, the Intergovernmental Authority on Development, IGAD, countries want international financial institutions to cancel debt of their member states in order to free up the said funds to fight the COVID-19 pandemic. The African Union has indicated that it is seeking at least $150 billion of emergency assistance to support its continent's efforts in fighting the disease. During the IGAD Extraordinary Summit via video conference held earlier this week, the leaders emphasized the need for a collective strategy to combat the COVID-19. The East African region currently has 483 positive cases of COVID-19. Sarah Kimani reports.
The IGAD region faces a double emergency: the desert locust invasion and now the coronavirus. The United Nations Food and Agricultural Organization, FAO, has warned that swarms of desert locusts threaten food security for at least 25 million people in the region.
Our countries are caught between the hammer and the anvil. On one hand, we have barely recovered from the first round of the worst desert locust invasion that our region has seen in 25 years. A second invasion is on its way, threatening to severely affect Kenya, Ethiopia, South Sudan, and Somalia. On the other hand, we now have to contend with the threat of full-blown outbreak of COVID-19 that may claim thousands of lives, hundreds of thousands of lives.
Now the region's economy is staring at huge losses resulting from the coronavirus outbreak as a result of emergency medical investment, a slowdown in manufacturing, trade, tourism, as well as a reduction in diaspora remittances. Kenya, Uganda, Sudan, Somalia, Djibouti and Ethiopia have all reported positive cases of COVID-19.
It has profound impact on our economies. Over the years, we have made excellent progress in terms of achieving the SDGs, progress in all fronts, but particularly in the economic front. This pandemic has the potential to destroy all this and send us right back where we started decades ago.
Africa needs commitment from World Bank Group and IMF to inject liquidity, not less than USD 150 billion.
Only one member state has not reported a positive case among the member states.
To date, the government of the Republic of South Sudan has not registered any case of coronavirus yet, but we have taken critical actions to minimize the risk of exposure despite economic and social damage these actions entail.
The leaders agreed to adopt a regional approach to combating COVID-19.
There should be no doubts in our minds that we remain in real danger of devastating upsurges unless we take decisive collaborative actions together. It is therefore necessary that we not only share our experiences, but more importantly, agree on collective regional response systems to this pandemic. This is not a problem that can be successfully fought and won by one nation alone. It needs us working together.
This, they said, will be done through the setup of an emergency fund for the control of pandemic diseases and the strengthening of health systems in the region. They also want the international lending institutions to cancel their debts to allow them deal with the disease.
In that context, it is vital that we put in place a regional response to the pandemic, but also to the underlying socio-economic crisis. Our response can then be twofold. First, build up our regional testing and medical equipment capabilities through the creation of an eager COVID-19 fund in order to stamp down the virus not only in our respective countries, but also within our region, so that we can resume some economic activity at our level.
The leaders also agreed to mobilize international community support to combat COVID-19 through the building of local manufacturing capacity for medical equipment supplies for the fight of the pandemic diseases. Already, Ethiopia and Kenya have announced plans to manufacture personal protective equipment locally. Sarah Kimani, SABC News, Kenya.
An absolute decimation on the whole share index.
Stock's feeling an enormous amount of pain. I think a lot of people are very concerned.
We already expect the Reserve Bank to act aggressively.
Don't over-pressurize them. Leave the conversation to me and the governor of the South African Reserve Bank.
Meter taxi drivers, you find them a lot when you come out from their arrivals. They say business today particularly has been very bad and they're very concerned.
A school with a great academic record, a beacon of hope for parents and learners. Now the principal faces charges of sexual grooming and manipulation.
The suspect was arrested by the FCS unit.
We have a reason to believe that the allegations have merit. Our labor section has immediately drafted a letter of suspension.
And let's go back to the story. As we said earlier on, there are warnings that Africa could be worse hit by the coronavirus. While the prevalence of the virus in countries such as Italy has been detected in elderly patients, Africa faces a unique challenge. Although the continent boasts a young population, diseases such as malaria, HIV/AIDS and TB put them at high risk. Right now we are joined by Dr. John Ngangisong, who is the director of Africa Center of Disease Control and Prevention, who joins us now on the line. Dr. John, good evening and welcome to African Perspective. I was saying earlier on, there was a package that we played from one of our reporters, Coletta Wanjohi, where an indication has been that when it comes to the ventilators, for instance, which are quite crucial in the fight against the coronavirus, especially for critical patients, we have seen an escalation in the price of these ventilators. And in the report, she indicates that at least by sixfold. I'd like to hear what the CDC's response to this is and whether or not there is a way to try and curb the escalating costs of these crucial ventilators.
Yes, the CDC and the African Union Commission is very concerned with that. And we know that it is a matter of time before our member states will begin to need many of such devices. And we are actually working collectively to ensure that, A, we have access to it by pooling our resources to get much of these devices from China. We completely condemn any attempts to take advantage of this unfortunate situation, this pandemic, to increase the prices of these very critical devices there. So the African Union and the Africa Centers for Disease Control strongly believe that we need a coordinated approach, a collaborative approach, a cooperative approach in order to win across the entire continent. The fight has to be locally, but the collective battle has to be won at the continental level.
Certainly. And looking at, since the declaration by the WHO on the 11th of March that the coronavirus is now a pandemic, since that particular announcement and that particular declaration, are you satisfied with the response from African leaders, at least, to try and mitigate and try to contain the spread of the virus?
Well, the leadership at the continental level has been extraordinary. Just last Thursday, the Bureau of the Head of State listened carefully to a briefing from the Africa CDC and endorsed the need to have a strong continental strategy, which is underpinned by the collaboration and cooperation that I mentioned. They've also established a COVID fund for the continent and pledged almost $12.5 million. I think that shows strong commitment and leadership. Now, we are still at the dawn of our pandemic with about 5,700 cases, but that is expected to escalate very quickly. Remember, our first case on the continent was just on February 17, and by April 1st, we are recording 5,700. That indicates that we would have a huge number of infected individuals on the continent.
But what about countries that are not listening and adhering to advice that's being given, at least from the WHO as well as from the CDC, around trying to prevent contact as much as possible? I know that there is one of the articles in the World Economic Forum indicating that there are some countries on the continent that are still allowing church gatherings to continue.
My advice and strong recommendation to the leadership of our continent across the board is that we have to take this very seriously, extremely seriously. We've seen what happened in China. We are currently seeing what is going on in Europe and the United States. Let me just focus maybe on the situation in the United States for 1 second. On the 1st of March, there were less than 20 cases. And today, by 1st of April, we have almost 200,000 cases with about 4,500 deaths. So this enemy is a terrible enemy. We have to take it very, very seriously as a continent.
Is there anything at all that the CDC as well as the African Union can do beyond just calling on member states to try and implement some of these strict rules and regulations? Because after all, we know that how this disease can spread rapidly. And looking, for instance, in one case in Botswana, where the Botswana government has confirmed that one of the cases that they have of the patient who died was a person who was traveling from South Africa.
Yes, the African CDC has been supporting countries in the preparedness plan since January. We've supported member states in several areas, including expansion of diagnostic testing from almost 2 countries to about 48 countries now. We've supported them in areas related to enhanced screening and surveillance at the port of entry, in the areas of infection disease control and prevention. So we do not just provide call to action, but as a technical agency, we work closely with the World Health Organization to support countries to build their capacity to prepare to respond. I think it is thanks to that capacity that was developed for diagnostics that countries are detecting the viruses as you see across the continent.
Sure. So my question is more around how does the African Union impose on member states to make sure that they adhere to the rules, the regulations, as well as the advice that comes from the CDC? Because we know, at least from the African peer review mechanism, there have been some complaints that when advice is being given to member states don't implement that. And this, of course, then has an impact on neighboring countries, hence the example that I give of Botswana. That in Botswana, the patient who died is said to have traveled from South Africa into Botswana. So is there anything more that the African Union as well as the CDC can do to make sure that these countries implement the rules as well as the recommendations that are being made?
Yes, absolutely. Just last week, the Bureau of the Head of State established a coordination mechanism where 10 ministers of health representing each of the 5 regions will come together and make sure that they coordinate their actions and enforce some of these recommendations and report back to the Bureau of the Head of State. So I think that is, you begin to see a lot of such coordination and enforcement at the continental level.
Okay, let's move on to the population itself, a population of just over 1.3 billion on the continent, and of course a very young population at that as well. And the concern that has been raised that with the young population in sub-Saharan Africa, you have diseases such as malaria, HIV/AIDS, as well as TB. What should the unique approach be from the continent side so that we don't adopt as a blueprint what Italy as well as China has done to try and contain the spread of the virus?
I think if you look across the continent now, many countries have implemented lockdown approaches, including closures of borders, airspace, and many other measures that restrict movement of people. This is the opportunity. The opportunity is within the next 2 weeks to 3 weeks for countries that have implemented those important measures to intensify public health measures. That is, increase testing, identify people who are infected, isolate them, and look for their contacts. We have to increase the contact tracing ability across the board so that they take advantage of the lockdown to enhance ability to control and contain this virus. That is one. Second, I know social distancing is critical. We cannot ignore that. It's a proven public health measure that has been used over and over to slow down the spread of infectious diseases. We have to implement that. I know it's challenging on the continent because of our cultural context, the sociological context, but we have to implement social distancing as much as possible during this very critical period.
Another question, of course, is also funds being made available, and we've now seen from the East African Bloc, and this is also a call that has been made by the African Union, as well as a call that was being made at the G20 as well. What is the CDC saying to international financiers during this period as countries struggle even to procure crucial medication and crucial machinery as well that is needed because of their budgets being very low, because they have to be paying back debt that they owe?
Yeah, I think you touch on a very important question. I've always maintained from the start of this crisis that it's a global crisis. It requires a global action and global solidarity. Africa cannot and should not be neglected in this effort. The COVID-19 will not be eliminated anywhere in the world if we still have it in Africa. So I think we have to coordinate efforts and express global solidarity for the African situation. The continent as a whole doesn't have the billions of dollars that Western economies are injecting into the economies. We have to work with the World Bank, the International Monetary Fund, and other bilaterals to come to the support of Africa urgently. We still have a window of opportunity to fight, to wage a spirited fight and control this pandemic, but that help needs to come now. Otherwise, we'll miss the opportunity to impact and prevent the rapid spread of this virus in Africa.
Has the CDC at all looked at what the predictions are, forecasts, considering that the continent is obviously moving into the cold winter season, And we heard earlier on from our Minister of Health as well, saying that this could be very problematic for the country because some of the symptoms that would be symptoms presented of a seasonal flu that we're used to, which comes every winter. Do you have any prediction at all that during this period, these are the number of cases that the continent as a whole could face?
Yes, I mean, the continent, as you know, is very heterogeneous. Not all member states or countries in Africa will be experiencing the winter period. But what you said is extremely valid for Southern Africa. You don't want to have a situation where you're compounding symptoms of a common cold with COVID-19. I think that is important. We are doing projections, modeling, working with experts to project what our numbers will be. That is important to understand how the disease will spread, but also to enable us to prepare member states on how to respond to that. We estimate that by the end of April, you have countries who begin to hit about 10,000 to 15,000 cases on the continent. So I think we continue to factor in many variables to arrive at those numbers.
Yeah. Dr. John, just one last one is that we have 49 countries on the continent that have confirmed cases of COVID-19. What is it about the other countries that we don't have any case of COVID-19, including Malawi, South Sudan, Lesotho, as well as Western Sahara?
I think it's just a question of time before you get cases. This virus has spread extremely rapidly across Africa. As I indicated, in just February, there was just one country with a reported imported case, and look at where we are today. So I think one has to assume that it's a matter of time before all countries will be affected.
Thank you so much. That is Dr. John Ngangasong, who is the Director of Africa Centers for Disease Control and Prevention. And with that said, one of those countries that don't have any cases confirmed is Lesotho. Like many other countries on the African continent, the Kingdom of Lesotho has followed suit in invoking a total shutdown while allowing only essential services to continue functioning on limited parameters. The 3-week long lockdown is forcing many to find ways to stay fit in their confined spaces.
Lesotho is under lockdown, but hardly 3 days in, complaints of security officers being heavy-handed are flooding social media. Police, however, say no one has come to lay a charge nor complain. While there has not been any official positive case of the coronavirus, the lockdown is pushing many to be creative in order to work from home or physically keep fit.
The whole idea is to create a structure around your day so that you have some kind of a timetable and do productive things so that you emerge a much better person on the other side, and of course spend as much time as possible with loved ones that are close and ones that are distant.
Some games more mental orientated, while some more physically challenging. And when the young ones also need to get physical, some music does the trick. Anything that can keep the family intact will do for now.
So stay at home, wash your hands, and try and observe that tricky and sneaky social distance. Rapelang Khatebe, SABC News, this time in Lady Brand, Free State.
Zimbabwe, meanwhile, on Monday began a 21-day lockdown to try and stop the spread of the coronavirus. The healthcare advocates and the business community are generally supportive, but have aired concerns that they say the government needs to address. So far, there are only 9 confirmed cases of the virus in Zimbabwe and only 1 death. We now speak to Effet Musikewa, who is our reporter in Zimbabwe. Effet, good evening and welcome to African Perspective. Since this lockdown has been implemented, what we have heard from some citizens of Zimbabwe is that they were ill-prepared, they weren't given enough time.
Well, that is the sentiment, but you saw that most of the prominent, even including the opposition leaders, were calling for an earlier lockdown. People were saying that basing on Zimbabwe's healthcare system, it was not a good idea to not, implement an early lockdown because they're saying that Zimbabwe is better off preventing the disease from entering, because once the disease is within the borders of Zimbabwe, it will be very difficult and a lot of lives will be lost. So really, the sentiments vary depending on who you're speaking to. But most of those sentiments do come from people that are in the informal sector who live on day to day. They live from hand to mouth. So they will be complaining that they did not have enough time, to put resources in place so that they'll be able to go through these 21 days.
What about the medical professionals? Because they certainly play quite a crucial role, and earlier on this month, or last month rather, they downed tools. Has the government found a way to get them back at work?
Well, tools just a few days before the lockdown, just as early as less than a week ago, citing that they did not have equipment to use. Since then, the government has received donations. The private sector has come in to aid, and some of the doctors, if not most of them, are back at work. Right now, currently, the cases are still very small, like we did. Only about 8 cases. So really, it means that they do not have a lot of work to do. The testing also is just above 200. So a few people have been tested for the disease. So currently, because there hasn't been too many cases, it's been, the few doctors or the few medical personnel that were on duty were able to attend to the cases that
And we also, Effort, I hope that you're still there. We're also hearing that there are allegations of the water crisis, which could be sabotage due to the coronavirus lockdown.
Well, it's not sabotage, but indeed.
Okay. Well, we seem to have lost Effort there. That was Effort joining us from Zimbabwe, as we have indicated that there have been 9 cases that have been confirmed in Zimbabwe, as well as 1 death. We go to a quick ad break. When we come back, we will be looking at what's happening in Botswana, as the country has also announced a lockdown.
Coronavirus spread internationally and has now hit the shores of South Africa. What are the chances that there will be massive spread here at home?
The probability that we will get some local transmission is likely very high.
And if that happens, will the country be ready for that?
In terms of laboratory testing preparedness, we are prepared.
But who's at risk of contracting this illness?
Anyone who's within a very close proximity, and it's generally recognized to be less than a meter, might inhale or breathe in those little droplets that are then expelled by the infected person.
The most important question is, how can we prevent spread of the virus?
Washing hands with soap and water is still the most effective. Hand sanitizers are an option when you can't wash your hands or your hands are not visibly dirty.
An absolute decimation on the whole share index.
Stock's feeling an enormous amount of pain. I think a lot of people are very concerned.
We already expect the Reserve Bank to act aggressively.
Don't overpressurize them. Leave the conversation to me and the governor of the South African Reserve Bank.
Meter taxi drivers, you find them a lot when you come out from their arrivals. They say business today particularly has been very bad, and they're very concerned.
Meanwhile, Botswana enters a 28-day lockdown tomorrow in efforts to curb a full outbreak of the novel coronavirus in the country. The country only has 4 confirmed cases, with one of them resulting in a death. President Mokgweetsi Masisi declared a state of emergency yesterday, saying he is worried by the high number of positive COVID-19 cases in the neighboring countries. He said that concern was that he saw last week a sudden migration into the country after neighboring countries like South Africa announced their lockdowns. Right now, we're joined by Sharon Matala, who is a reporter for The Voice in Botswana, and she joins us now on the line. Good evening, Sharon, and welcome to African Perspective. How has the announcement of this lockdown been received, as well as the announcement of the state of emergency?
Yes, thank you very much for having me on your show. As you have rightly mentioned, our president did mention that, there will be a lockdown coming tomorrow at midnight. That means from Friday morning, there will be absolutely no movement in Botswana. The news was sort of to be expected, because by the weekend, military officers were summoned back, those who were on leave and those who were who were sent to other stations, were summoned back to their stations. So we could actually notice that there is a looming lockdown to be announced very soon. So when the president actually did announce it on Tuesday, it didn't really come as a surprise. But what did come as a surprise, as you just mentioned, that we registered our first death as a result of corona, was that the old lady, the 79-year-old lady, actually traveled to South Africa and came back with signs of corona. And it really has caused a bit of concern, especially at the village where she comes from. The village is about 15 kilometers away from the capital city, and there is a bit of chaos going on in the village as we speak.
Is there a tracking and tracing efforts that are currently underway? Because what we've seen, for instance, in countries like South Africa, immediately when there is a confirmed case of the coronavirus, tracking and tracing then gets underway. Yes. But I also want you to just quickly touch on the attitude of the villagers in the area where this old lady came from, and what is their attitude towards this confirmed case as well as the death?
Well, they feel it's a bit unfair, because they were not told. Remember, she died on last week Thursday and was buried on Saturday. So the villagers or the family were not told that she died as a result of corona. So they attended the funeral as is normal, and there was a lot of interaction and between the villagers and the families and the family of the deceased. So they feel like they should have been told that this is the real reason or why she had died, so that at least maybe they wouldn't have probably not attended the funeral. As of this morning, about 14 people have been quarantined who have been tracked down, possibly having had interaction with the family of the deceased. As of this afternoon, health officials were in the village asking everybody who had attended the funeral, to come in for testing. So it's a bit of a somber mood in the village of Ramosa, because they feel like they should have been told. I've just been talking with some of the people who had actually received the corpse at the mortuary. They treated the corpse just as any other corpse, and they were not told that this is a body of a person who died as a result of corona. So they too have been quarantined as of this afternoon, the employees of the said mortuary. So they feel like they should have been told, and then they would have reduced contact with the deceased and or her family.
Tell us quickly about foreign nationals that are in Botswana. Are there any plans to repatriate them?
No. It's not yet quite clear. There is a press conference that's going to be hosted by the minister tomorrow at 10 a.m. to address the foreign nationals. But as of now, there's no mention as to what will happen to the foreign nationals.
And quickly tell us about what the opposition is saying about the efforts that are being made by the government to try and contain the spread of the virus, and also the availability of health practitioners.
Yes, it's actually quite interesting that you mentioned that as of yesterday, the Botswana Nurses Union had actually issued an intent to sue the Botswana government because they felt like the Botswana government were not treating them fairly. But Botswana government responded this morning to say that, you know, they will abide by the WHO regulations and they will provide protective clothing to the nurses, and they will actually isolate them, the nurses, that is, from their family, So I guess that intention to sue will not go on for now because government this morning actually responded to the nurses. As of the opposition, well, they have actually commended that Botswana this morning mentioned that they've set aside 40 million pula, which will help the small businesses, you know, stay afloat throughout the duration of the lockdown. So the opposition have actually applauded that move from government. You'd recall that, you know, government was also in talks with the commercial banks, local commercial banks, to at least give a little bit waiver for loan payments for at least for the next 3 months. So they did announce this afternoon that banks will give out sort of like a payment holiday for the next 3 months with an option of extending for the next 6 months. So that means, you know, those who will be greatly affected by the lockdown will at least have 3 months of not actually paying their loans to commercial banks.
Sharon,
and
thank
they've
you so
actually
much.
also announced, yes.
Unfortunately, Sharon, we've run out of time, but thank you so much for your time. That is Sharon Matala from The Voice in Botswana. Let's move overseas now, where the leading public health institution in the United States has now flagged that up to 25% of COVID-19 infected people are asymptomatic and might therefore be unwittingly spreading the virus. The federal guidance that only people who were feeling sick should wear masks is thus being reviewed by the Center for Disease Control, as President Donald Trump warned that the following social distancing guidance had now become a matter of life or death. More than 900 people died in the country in the last 24 hours as they're taking the national death toll, taking the national toll to around over 4,000 as the caseload increased to almost 200,000.
In a chilling outlook for the country, particularly the epicenter of New York City, where more than 1,000 people have died alone, the president didn't mince his words.
We're going to go through a very tough 2 weeks. And then hopefully, as the experts are predicting, as I think a lot of us are predicting after having studied it so hard, you're going to start seeing some real light at the end of the tunnel. But this is going to be a very painful, very, very painful 2 weeks. When you look and see at night the kind of death that's been caused by this invisible enemy, it's incredible.
This field hospital in Central Park, New York, is one of several supplementary facilities set up to deal with an expected surge in patients in the coming weeks. From coast to coast, convention centers are being converted into makeshift hospitals as projections continue to show that up to 240,000 people could die.
This is a number that we need to anticipate, but we don't necessarily have to accept it as being inevitable. And that's getting back to what I'm saying about we can influence this to a varying degrees. And if we influence it to the maximum, we don't have to accept that. That's something we need to anticipate. But I want to do, not I, all of us want to do much, much better than that.
With the CDC revealing that almost a quarter of all those infected don't show any symptoms. Essentially people who appear healthy but unwittingly make others sick.
So I know it's stressful to follow the guidelines, but it is more stressful and more difficult to the soldiers on the front line. As we started and we will end with its communities that will do this, there's no magic bullet, there's no magic vaccine or therapy. It's just behaviors. Each of our behaviors translating into something that changes the course of this viral pandemic over the next 30 days.
Experts have identified worrying signs in the metropolitan areas of Detroit, Michigan, New Orleans, Louisiana, Chicago, Illinois, and Miami, Florida, as they work to prevent a repeat of the situation in New York.
This is going to be a rough 2 or 3 weeks. This is going to be one of the roughest 2 or 3 weeks we've ever had in our country. We're going to lose thousands of people. When I see 28, 29 people from the governor of New Jersey 29 people. When you see 173 people died in New York yesterday, or whatever the number was, I think it was more than that. When you see the kind of numbers that we're witnessing, we've never seen numbers like that.
I am particularly concerned with the African continent.
Earlier, the United Nations Secretary-General called the coronavirus the biggest challenge facing the world since World War II. Thousands of nurses, paramedics and emergency medical technicians, in addition to some 250 ambulances, are being sent to the New York region from around the country to join the National Guard and the Navy in assisting frontline health workers in this area deal with what is expected to be the spiraling demand in the coming month. And that is no April Fool's joke. Sherwin Briceby's SABC News, New York.
Well, for more on this, we now go to our correspondent, Sherwin Briceby, who joins us via Skype from New York. Good evening, Sherwin. First of all, before we get into the conversation around the masks, over a month's time, how did the United States find itself in such a situation where you have over 4,000 cases, 4,000 deaths that have been confirmed, and over 200 confirmed infection cases? How did this happen?
Well, I don't think the experts necessarily have those answers yet. If you listen to the likes of Nancy Pelosi, the Speaker of the House, she'll talk to you about how post-mortem needs to be done once the public health emergency has been arrested. But certainly anecdotal conversations that we are having in places like this epicenter in New York, where I am, is that this virus was spreading long before the first case was known. And I think what this speaks to, Aldrin, is the fact that not every person that is infected with COVID-19 is showing symptoms. There are many people, some 25% according to the Centers for Disease Control, walking around being asymptomatic, essentially having the ability, not feeling ill, not showing symptoms, no fever, no cough, no pneumonia, and then the ability then, unbeknown to them, infecting other people who then get sick. So there's a lot of unknowns still known about this disease. But certainly what we are hearing anecdotally is that this virus was present in the United States. There was community transfer in the United States way before the very first case was identified, not only in Washington state, not only in California, but here in New York. And so we've seen this spiral, as you correctly point out, the record now for the most number of cases, an inauspicious record at that, at over 200,000 cases in the United States and growing, some 4,500 dead, accounting for at least 10% of the global death toll. This is the epicenter. It's happening right now as we speak. And so certainly what we're hearing from the state level, local government and the federal government is that this is a moment for all hands on deck.
Sure. And the debate around the masks has been something that has been ranging on from country to country. Even here in South Africa, earlier on, there was a press briefing where our MEC of Health, Dr. Masuku, was speaking to this and saying that academics are having debates amongst themselves as well around the use of the mask. And what's the debate like in the USA and the type of masks as well? Because I'm hearing that there are even some people who are calling for homemade masks made from normal cotton cloth.
What you're hearing from the experts, just in terms of what kind of mask to use, they're saying you can basically use a scarf and cover your face. Because the initial guidance we got from the federal government was that because of the lack of masks that are available in terms of hospital supplies and available for frontline health workers who needed them the most, given their proximity to ill patients, that the general public certainly didn't need these masks. And if they conducted social distancing, the 2 meters apart rule, not using public transport, avoiding closed, confined spaces, that you don't necessarily need a mask. What we are now hearing, based on what we were just talking about that 25% of unknowns or not showing symptoms, you don't know if someone's sick or not. So as a precautionary measure, there's now a debate happening at the federal level, and maybe we'll hear from President Donald Trump within an hour at his daily White House coronavirus task force briefing that this has changed. But they are looking at this very closely. There hasn't been a firm decision as to whether everybody should wear a mask, but that's certainly a conversation that's also going on here.
Is there a conversation at all around whether the disease can actually, in fact, be airborne as well? Because we've heard, for instance, the WHO had said before that it's not airborne, but now we are seeing that some cases and some medical practitioners arguing that actually the virus can survive in the air.
I'm going to give you my perspective as a journalist, not a medical practitioner, but what we're hearing from people of, the experts is that the virus can, if you're in close proximity to someone that is ill, they talk about these little air bubbles or these little spit bubbles that come out of a person's mouth. If it goes directly into your eye or if you inhale it, then you will contract the virus. So this is why the guidance is to avoid being in close proximity to people. They talk about the social distancing. It's very, very important. They say 6 feet apart in New York. That's around 2 meters for people that use the metric system. And so, that has been the guidance. My understanding, Eldrin, is that it can linger in the air for about 45 seconds, but you hear different versions from different people as, a panic and anxiety can shape the way people react. But certainly if you're out in an open space, my understanding is if you're keeping your distance, you don't necessarily need to wear a mask because the bubbles won't get to you.
Sure. Let's quickly touch on medical practitioners themselves and those who have been infected. And I've seen that this has been a concern in the United States as well. I think the stats that I saw earlier on was around 200 medical professionals who have been infected, and some of the videos that have been doing the rounds as well. Medical professionals, doctors taking videos of themselves complaining that the states are not ready to combat this virus.
Well, it's a shortage, right? You've been hearing this ongoing conversation about the shortage of protective equipment, gear for the frontline health workers. The New York mayor has been quite vociferous in his démarches to the federal government in terms of the lack of supplies, whether you're talking about masks, whether you're talking about gloves, whether you're talking about overalls. You've seen pictures of nurses at hospitals in Manhattan, New York, wearing refitted garbage bags because they do not have the protective gear that was required. You hear constantly governors in various states around this country talking about the lack of ventilators. You were having that conversation with the expert, with the head of the Centers for Disease Control in Africa. This is a global problem because this is a life-saving device and there are just not enough of them. And what you're hearing from governors, complaints from governors in this country, is that they're not just competing from one state to another based on trying to get the best price. States are competing for ventilators, and then in addition to competing among states, they are now competing with the federal government, who is also competing with all the other nations around the world. So there's a great deal of a supply chain shortage here in terms of ventilators and that protective gear. And this has been an ongoing conversation that health practitioners, as you correctly point out, have been having on social media. And there's also a statistic that will shock you, Aldrin. Some 17% of the New York Police Department is off sick as I speak to you today.
So, and just in 30 seconds quickly, the British American Tobacco company working on a vaccine. Just quickly tell us about that, 30 seconds.
Well, there are a number of vaccines. You highlight one. There are a number of vaccines. I understand Johnson & Johnson is also going to be working on a vaccine. We understand that the Chinese and the Germans are also working on a vaccine. So I think it's going to be a race, much like the vaccine that they're working on for HIV and AIDS. There's a race to get this vaccine out. But Aldrin, the vaccine is not going to help the situation right now. The vaccine is between 12 and 18 months away. Forget about the vaccine for now. This is going to be about therapeutic medicine, possibly the anti-malaria medication that we are seeing, very promising in terms of alleviating the stress on very ill patients. But forget about the vaccine. This is about social distancing. It's the only way we are going to arrest the disease right now.
Thank you so much. That's Sherwin Bryce-Peace joining us from New York. We've come to the end of this evening's show. Thank you so much for watching. We are back again next week, same time, same place. But in closing, even though the world is consumed by doom and gloom, as more countries are reporting cases of the coronavirus, people are losing their lives as well. Nature continues to prevail. The Victoria Falls Musiwathunya came to life as the Zambezi River flows after heavy rains. We leave you with these beautiful pictures of the Victoria Falls, which was threatened by drought earlier on.
an absolute decimation on the whole share index.
Stocks feeling an enormous amount of pain. I think a lot of people very concerned.
We already expect the Reserve Bank to act aggressively.
Don't over-pressurize them. Leave the conversation to me and the governor of the South African Reserve Bank.
Meter taxi drivers, you find them a lot when you come out from their arrivals. They say business today particularly has been very bad and they're very concerned.